Hello everybody and welcome to the Carlin Cymru revision sessions. This session this evening will focus on GCSE health and social care and will be presented by Mrs Lewis from e-sgol Gofyn Cymru. The session will last around 45 minutes where Mrs Lewis will run through the relevant content. If you have any questions during the session, then please use the question and answer section and we'll do our best to answer your questions. Today's session will be recorded and the recording and any relevant resources will be uploaded to the e-sgol website under the Carlin Cymru tab shortly after this recording. Thank you, Mrs Lewis, over to you.
Okay, good evening and welcome to the fourth session. Today we're going to be looking at some exam questions as we've previously done, and we'll also be looking at the circumstances that can affect our health and well-being, as well as screening programmes and immunisation programmes. WJEC has released information beforehand for your examination. This has been posted on their website. I mentioned this last week. This would be a valuable revision tool for yourselves, as it does include information on the higher tariff marks. So if you've not downloaded that or been given it yet by your teacher, that's something that you can request as it is available to students. Okay, so just the perhaps final reminder of your exam on Wednesday the 24th of May. This will contribute to 40% of your qualification, and then obviously the 60% that's remaining will be awarded to you from coursework task 1 and task 2. Okay, so first of all tonight, we're going to look at different types of circumstances that can affect our health and well-being. Circumstances can be categorised into expected and unexpected life events. Okay, hopefully by the end of this session you will be able to identify which circumstances are expected and unexpected, and also then the impact of these life events on your development. Okay, so as I said, some of these are predictable and perhaps what we could categorize as expected, and some of these then are unpredictable or unexpected life events. Okay, the unexpected or unpredictable circumstances would be the death of a partner or friend. Some students find this hard to grasp just because of everyone will die. What we're trying to refer to here is if your friend or partner dies suddenly and unexpectedly. Okay, obviously you're not likely to be, well, hoping you're not likely to be made redundant. Okay, you're not going to be involved hopefully with a serious accident or illness, acquire a disability, get divorced, or move into residential care. Okay, so these are obviously life events, but we don't particularly want these to happen to us, and if they do occur, they are perhaps unexpected. Okay, so a low tariff mark on this content would be identify an unexpected life event. So again, you'd only get 1 mark for that. However, I believe that that's a silly 1 mark that students thrown away. So we need to remember what these unexpected or unpredictable life events are. Okay, so maybe you have a bubble diagram at home, and in your bubble you can put unpredictable life events and then have these examples around that bubble diagram then, so you can revise these. Okay, we then have the expected or predictable life events, so things that we know are going to occur at different life stages throughout our life. Okay, so obviously entering puberty, women going through the menopause, and we will start nursery, school, college, university, but also we will leave education. We will potentially perhaps move from our families when we're a young adult ourselves, perhaps moving home as a family to a different house or a different area. We're going to start work. We're going to retire, hopefully. There will be a birth of a sibling, having children if you're an adult, obviously a birth of a sibling if you're a younger brother or sister. And sorry, you can just about see this through the writing, living with a partner, getting married, or being involved in a civil partnership. Okay. So how I ask my students to differentiate between what are the predictable and unpredictable is what are the things perhaps that we're looking forward to, and they are probably the expected life events. And then unfortunately, we do have the unexpected and the ones that are perhaps not particularly nice and would affect us probably in a more negative way. Okay, so like I say, just a simple bubble diagram there, and you should be able to remember these examples for a low tariff mark. However, if we're looking then more at the higher tariff marks, okay, so the bands where we perhaps have 4, 5, 6 marks, we could come across a situation where one of these life events has taken place, and they would ask you to identify whether it's an unexpected or expected, which would be your 1 mark, and then discuss the effects. Okay, so in this example that I have on the screen now, Barry is 42 years old. He's recently split up with his wife and they will be getting a divorce. They have 2 children together, aged 6 and 9 years of age. Discuss the social, emotional and intelligent effects that Barry's divorce could have on his development. Okay, so the key things perhaps that I would look at here is that we're looking at his development, nothing to do with the children that are age 6 and 9. Okay, and when we then look at development, they've actually mentioned which areas of development. Okay, so we have to look at how this would affect Barry in a social, emotional and in way. Okay, some students would make the mistake of perhaps talking about the children and the effects on the children, and obviously that's not understanding the question. Okay, so if we looked first of the effects of the divorce on Barry's intellectual development, okay, we could say that Barry has difficulty perhaps concentrating on daily events, such as his work. He may also need to take time off from his work. Okay, he perhaps can't make correct decisions. He's not focused and he's not performing at his best in terms of his mind. Okay, then emotionally, now we could look at this in a positive and negative way. Maybe Barry emotionally is feeling very happy because he is now going through a divorce, because perhaps the relationship has been a bad relationship for a number of years. Or obviously we could look at the negative effects that this divorce is going to have on him. Okay, so he could be stressed, he could be very upset, there will be anxiety about his new life and how he is going to perhaps continue in the same way. He worries about the effects this could have on his children. But like I said, then he could also be feeling a little bit of relief and happiness because he's now leaving a negative relationship. Socially then, okay, we could also look at the positive and negative effects, because the question doesn't ask us to look at something in a positive or negative way. We can discuss both of them. He could become quite isolated and withdrawn from social events. Maybe he feels a little bit embarrassed and awkward about talking about this with others, so he doesn't engage himself in events. He could possibly lose friends because of joint friendships that he and his wife previously shared. But also he may have new opportunities now to develop his own group of friends or circle of friends. Okay, and potentially he could have more or increased opportunity to socialize, because whatever they're doing with the children in terms of perhaps splitting the care, Barry might find himself now evenings or weekends free because his ex-wife is now obviously caring for the children on those evenings. Okay. So as long as we've got the correct structure to this question and we understand what's being asked in terms of the 3 areas of development, and that we can look at the both positive and negative, I feel that this is quite an open-ended question. Okay, so we can have a look now at another example of a life event, which is a bereavement. So Gwen is 74 years old. She's recently lost her husband, who she was with for 50 years. Discuss the physical, emotional and social effects on development that Gwen could experience due to the loss of her husband. Okay, so again, looking at that question, discuss the physical, emotional and social effects on development that Gwen could experience due to the loss of her husband. We could look at this on a positive and negative side. Okay, so if we looked at the physical situation first, okay, maybe we'd look at the negative in terms of Gwen is unable to sleep due to the sadness she's experiencing. She also has low energy levels and her immune system could become weaker. She may not be eating as well as she's previously done. She could perhaps be losing weight because of the lack of preparation for food or want to eat any food. And this could obviously make her very tired and be more prone to illnesses. Okay. The emotional state then. Now, personally, I would probably look at this just in a negative way, just because of she's obviously been with her husband for 50 years. Okay. So there's a lot of sadness, a lot of grief and loneliness, and perhaps anger in terms of why has he been taken from her. And then obviously this could lead to her feeling quite low in herself and in long term then depression. The social effects could be that Gwen might not want to be around other people, so she decides to isolate herself from others and from activities that perhaps she previously engaged with her husband. But also she could have more quality time now with members of the family or friends coming to the house to support her during her time of grieving and sadness. Okay, so again, similar kind of questions, but following on the same method of approach in terms of how to construct your answer to ensure that you're addressing what's being asked of you. Okay. Now we're going to move on to short and long-term health conditions. And WJEC wants students to be aware of certain long-term and short-term conditions. This is an exam question where you gain 1 mark for identifying the name of a long-term condition, and then obviously the more open-ended and higher tariff mark, which will be discussing the possible effects of this condition on an individual's development and well-being. Okay, so at the moment, if you're looking at that question, you're thinking, well, I'm not too sure what a long-term condition is or a short-term condition is. Hopefully the next 5 minutes will help you with your understanding, and then we'll revisit this question. Okay, so this has come directly from the specification. Okay, and what I'm going to do now is obviously just give you time just to look at that, and then we'll go about perhaps making this a little bit easier for you to understand in terms of making a code for both the long-term and short-term, and then can we look at preventable diseases also. Okay. So with my students, I've categorized these obviously into short and long term for them. I like to put things into a code just because I find that they will remember things far easier. So maybe this method works for you, maybe it doesn't, it's just a suggestion. So what we're looking at here for the short-term illnesses are things like food poisoning. Maybe you have a fever, a temperature, rash, a cough and a cold, so that's your double C, or scarlet fever. Okay, so the idea behind these illnesses are that it's something that's going to perhaps affect you only in a short-term way, and then once you overcome these problems, you will go back to resume normal life after maybe a week or two. Okay. Then, of course, we have the long-term illnesses. My code for these is Coach DD, okay? And these stands for Crohn's disease, obesity, arthritis, cancer, heart disease, diabetes, and dementia. You definitely need to go away and remember the short-term illnesses and long-term illnesses that's part of the specification, okay? We also have preventable illnesses, okay, and some of these are obviously connected to your short or long-term illnesses. So, for example, preventable illnesses through your diet would be obesity and type 2 diabetes. So if I was to eat a unhealthy or unbalanced diet, I might be more susceptible to suffer from these. If I am very inactive and lead a sedentary lifestyle, maybe I have more risk of heart disease, a stroke, or being obese. And then if I decide not to immunize myself against various diseases, then I have more chance of infection, and these can include diphtheria, polio, tetanus, and I was obviously going to put more recently COVID in there, okay? So that's your work there, that you need to go away and find a method to remember this, okay? When we return then to this exam question with name one long-term condition, okay, as long as you're comfortable then with discussing the effects of this condition on an individual's development, then your choice would be obviously something from my Coach DD code, okay? So with this answer, I will help you, and I will say that obesity, okay, is a long-term condition, and then discuss the possible effects of this condition on an individual's development and well-being. Now, perhaps some of you have watched every video up until now, okay? Sorry, I was going to write in Welsh then. Now, I have, sorry, bear with me just 2 seconds. When some of you will remember that I like to categorize things into 4 areas of development, okay, which would be PIEs, okay, so your physical development, intellectual, emotional, social, okay? So if we're looking at obesity and how obesity affects us physically, okay, you could say perhaps there are further or added pressure to your organs, okay, and you're putting obviously a lot of stress and necessary work on those organs to pump, for example, heart and blood around your body, okay? You may have issues with mobility due to carrying excess weight, okay? You could have extra pressure on your joints when you're walking and have more pain or perhaps problems related to your joints. Obviously, you could also be more prone to suffering from diabetes. Your heart could also be at risk from heart disease or maybe heart attack, and obviously stroke, okay? In terms of the intellectual, I find that is probably a hard area for students to answer in terms of how does being obese affect me intellectually. Perhaps what you could look at here is if you're not sleeping correctly, then obviously your brain cannot function because you cannot concentrate on tasks. Okay, maybe this could affect attendance if you're a student or somebody in school. This could affect your work, obviously performance if you're at work age, okay, of work age, I should say. Emotionally then, we could look at things like you cause yourself extra worry or stress because obviously you're feeling perhaps a little bit unwell. Maybe also you're a little bit embarrassed about your size and you're very perhaps shy or introvert because of this, okay? And then socially, maybe there are certain activities that you would like to participate in, however, you would feel quite awkward in doing so. So for example, we could want to go go-karting, okay, and because of your size, maybe you can't fit into the cart, okay, so you just stay at home. And with that, then you become isolated, and obviously you're giving yourself less opportunity to be in a social network with friends and colleagues, etc. Okay, so probably what I would suggest my students to do here is obviously remember what the names of all the short-term and long-term conditions are, and then probably having confidence in, say, 2 short-term and 2 long-term. So then if this question came about this year, you could then be happy in answering the effects of the conditions on an individual's development and well-being. And obviously what you've got to remember as well is this could be based on an individual of a certain age. Okay, so are we happy then in obviously discussing the effects on people from different life stages? Okay. Okay, so next area tonight is quite a big area, to be honest. Okay, so I'm hopefully going to complete this by the end of the session today. So there are several ways of us promoting health, growth, development and well-being. Okay, now we need to be aware of each of these. Okay, and these come down to immunization. Okay, so do we attend our immunizations as we should throughout our life stages? Do we attend screening services that are offered to us depending on our gender and our age? Do we also use the services that's available to us appropriately? And also, do we listen to the government guidelines and the initiatives that the government help individuals with? Okay, so there's a lot of information on this slide here. Okay, hopefully now I can narrow this down a little bit for you, and then you can understand how you can go about revising for this area. So this question was actually asked last year in the exam for year 10-11. So explain the benefits of one screening programme offered for babies and young children in Wales. Okay, so you definitely need to be aware of the screening programmes that are offered in Wales, but you also need to be aware of the screening programmes that are specifically offered to babies and young children, and then the ones that are offered to adults. Okay, so when I deliver this in school, we go through each of the screening programmes, and then I make sure that the children and my students understand the difference between each one of them and who they are appropriate to. Okay, so with this question, you would get 1 mark for actually identifying the correct screening programme, and then the remaining 4 marks would be your explanation then in terms of why this is offered. Okay, now I have warned my students on several occasions, because it says a screening programme, it has nothing to do with television. Okay, a screening programme is something that's offered to healthy individuals to ensure that we can perhaps pick up on any diseases that they might have that they are completely unaware of. Okay, so obviously this is a method of preventing and intervening early to support individuals by maintaining health throughout their life if possible. Okay, so these screening programs have a purpose to recognise defects. Okay, so for example, I could be a 60-year-old woman that attends my breast screening clinic for the first time, and they recognise that perhaps I have a mass in one breast. Perhaps I have no symptoms at all, okay, but because I've attended the screening programme, those defects or problems can be recognised. Okay, now obviously if something is recognised, okay, we can then ensure that that person has perhaps further investigations, and perhaps they can receive treatment because of their problem, and hopefully then continue with good health for a longer duration than if it wasn't identified. Okay, a lot of these individuals who get screened are individuals who appear, sorry, that should say healthy. Okay, so like I say, we have no idea at all, and we attend, and then unfortunately we receive the news that perhaps there is a mass or there is something developing that we weren't aware of. Okay, they can then make a diagnosis, okay, of what is identified. They can intervene as early as possible, hopefully then treat or possibly control the problem that we have. Okay, and then this will allow our lifestyle to improve if possible. Okay, now obviously in some situations, depending on when the problem is identified, we can be too late. However, we can offer a comfortable lifestyle rather than an improved lifestyle. Okay, so with adults, there are 5 recognised screening programs for adults. Okay, there is a very good website that allows you to watch videos on each of the 5 screening programs, and also there's information in terms of what individuals are these available to, for how long they're available, and obviously why they are presented during this timescale or certain gender. Okay, some of these are perhaps more common knowledge to others. So, for example, our breast screening services. People are perhaps more aware of this in terms of women appearing to have both breasts obviously screened to try and identify breast cancer. In the same term, bowel cancer, where we get the kit through the post, and obviously we need to take a sample of our stool, and that then is delivered back to the lab, where that can be analysed to identify whether we have any form of bowel cancer. And obviously our aortic aneurysm is just checking our walls in our aorta, just to make sure that we're not aware and that we're not susceptible to a burst aorta, which can obviously lead to a very sudden death. Okay, so you need to get your heads around these 5. Okay, it would be lovely if you could obviously name the correct program that's offered to an adult, and also describe the benefits of the screening program. Okay, now obviously some screening programs, they're different to each other, but the main purpose of them is the information that you can see above in terms of the recognising the defects, making a diagnosis, treating, controlling, improving lifestyle. So that doesn't alter too much depending on the test. Okay, so as long as we can identify which ones are appropriate to adults and children, and then go through the same kind of process in terms of the purpose of them, then you're not going to be too wrong, to be honest. Okay, so you're going to be obviously saying the purpose of bowel cancer and bowel screening services is to identify whether somebody has bowel cancer, in the same terms as breast cancer. Okay, we want to recognise as early as possible whether an individual presents with a mass in their breast. Okay, so it's the same idea regarding them all. Okay, obviously then we have children. I would be very surprised this year if they asked for children again, because they asked for children last year. Okay, however, we never know this, so it's worth remembering, but my gut instinct would be that it would probably be more of an adult question. So there are 3 types of children's screening test that's offered in the syllabus. Okay, this is the newborn hearing test in Wales, and the blood spot test, and then that should say the first 1,000 days. Okay, which is obviously something that ensures that parents and individuals who are born has the best start to life. The first 1,000 days are obviously key in terms of their development, in terms of their growth, and whether the support is in place during the first 1,000 days. Okay, so if then we revisited this question, explain the benefits of one screening programme offered for babies and young children in Wales, and you, for example, chose the hearing test. Okay, so obviously the purpose of this hearing screening programme would be to recognise whether individuals can hear at a very young age. If not, we can make a diagnosis in terms of what the problem is. The child and the family can be offered as much support as possible, and this would ensure then that that individual can develop as well as possible because of their perhaps difficulties that they are facing. Okay, now obviously identifying one screening program would also be your blood spot, which obviously recognises any blood disorders that an individual has. Again, making a diagnosis, offering support. ensuring that development can be as positive as possible. And in the same way as well, we could look at the first 1,000 days. And the first 1,000 days obviously make sure that the parents perhaps have support in terms of maybe breastfeeding, weaning, and feeding from a bottle, whether they're ensuring that they have the correct parenting skills, whether the individual then is growing and developing as well as possible with the health visitor obviously attending on a regular basis. Okay, so that's something that you can go away and revise and obviously be confident with. My gut feeling this year is they could be offering a question with regards to screening programs for adults, as I previously mentioned. Okay, so the next area now is the government. Basically, what is the government doing to ensure that we can prevent and intervene early if individuals obviously have problems with their health. Okay, so here's a question based on the government guidelines. So this is asking you to identify one area of health and well-being with government guidelines and support could support Ellie and her friends in a safe and social having a safe social life. Okay, so here Ellie is obviously an A-level student. She enjoys socialising and going to parties. Now there are certain areas with the government that they offer guidelines in terms of alcohol, in terms of obviously substances, diet, smoking, exercise, and STIs. Okay, so we need to perhaps pick an area here that you think is most appropriate to Ellie. Okay, we will revisit this question. And then you need to be able to explain that whatever area that you identified as AI, how this could have a positive effect on her health and well-being. Okay, so for some of you that are not aware, okay, the government offers us advice in terms of our diet. So we have what we call the Eat Well plate, okay, and the Eat Well plate then is a guide in terms of what our plate of food should look like in terms of carbohydrates, proteins, dairy products, fruit and vegetables. Okay, so in Ellie's circumstances here, we could think that, well, diet is obviously quite key for her to maintaining a healthy lifestyle. Okay, so that could be one that we could select. Being an 18-year-old and, well, I say 18, an A-level student, okay, maybe she would welcome some advice in terms of the risks that are out there in terms of sexually transmitted infections. And the government has a website called Frisky Wales, which offer advice in terms of different methods of contraception and also perhaps the indicators of certain STIs and how to get treated for them. So maybe Ellie would benefit from those also. Alcohol guidelines obviously is no alcohol until you're 18, and then when you are 18, are you drinking within the limits? And the advice that is given to us is provided from Dan 24/7 and Drink Away. So possibly this could be something that Ellie would benefit from. Substances then, or substances is an awkward one because obviously the idea behind substances is that we do not take substances. And again, Dan 24/7 is something that the government is helping us with in terms of our understanding of certain substances and how these affect us in the short term and long term. Okay, smoking then is very similar to substances in terms of, well, we shouldn't smoke, we shouldn't take substances. And we do have a website called Help Me Quit, which obviously gives us help guidelines in terms of coming to hopefully at the end of smoking. Okay, so if we revisit this question here now, personally, okay, as much as all of them could be correct, I would probably look at alcohol for Ellie, possibly STIs, okay, and you could say diet. Okay, so only one of these you would have to identify. Okay, now your decision should be based on the next question. Okay, are you confident in explaining how the health and well-being of Ellie and her friends could benefit from alcohol, from STIs, or from diet? Okay, and then once you've made your choice, so you might think, right, I'm going to eliminate STIs, I'm going to eliminate diet, and I'm going to go with alcohol there because I feel confident now in this second part. Okay, so with alcohol, you could think of this would hopefully make her aware of maintaining a healthy weight. Why? Because obviously alcohol is very high in calories, very high in sugar. This could affect her in terms of maybe carrying excess weight because of the content that's within the alcohol. Okay, you could think also that she has a better immune system because her body is not being used to absorb or digest the alcohol on a regular basis. She is drinking within her limits. She is 18 and she's following the guidelines that the government set out. Okay, you could say that she has healthier organs and heart and less stress is being placed on these. Okay, you could say emotionally that she is perhaps happier or has better control or management over her emotions because obviously she's not getting intoxicated and she's not behaving in a silly way. Okay, socially, you could say this would benefit her because of her friends. Obviously, she's getting on with her friends because she's never getting to that drunken state because she's following the guidelines provided from the government. And she values her friendship also because it's not an abusive relationship. You could say that she is also more, well, I should say, her safety, okay, is of a better standard. She's not getting into perhaps trouble with other individuals and also not getting into any problems with antisocial behaviour, for example. Okay, and also perhaps you could think that she is has better self-esteem. Okay, because she is maintaining control over herself and she is enjoying herself. She's going out to parties, however she never crosses that line between having drunk too much because she's listening to the government guidelines. Okay, you could also think of her relationships. Okay, she has a better quality in her relationships and she values this because of her understanding of the government guidelines. Okay, so please don't just jump into, all right, I'm going to talk about STIs here, if you then face the second question and you're a little bit more hesitant with your answer. Okay, right. Another method of preventing and intervening early is an immunisation programme. Okay, now every individual who was born in Wales is offered an immunisation programme, and the main reason for this is to protect and defend us against a variety of infections and diseases. Okay, so some examples that I have here are HPV, which is obviously offered to girls of school age. There's tetanus, there's meningococcal for meningitis. Now, whatever immunisation programme that we're entering, the main focus of the immunisation programme is protect and defend. If we obviously look at COVID and people who have attended for their COVID vaccines, that is the main purpose of this. Okay, you could also say that one of the reasons we immunise individuals is to protect us from epidemics. Okay, so if there is a problem and people can get immunized, obviously that is preventing the spread of the virus. Okay, we all then have the opportunity to enter an immunization schedule. Okay, so what this means is where individuals are offered immunizations throughout different life stages. Okay, so for example, if I am a baby, I enter an immunisation schedule and I have to present my baby to the health visitors and nurses at certain times during their infancy to ensure that they get protected. Okay, this obviously continues then through children, through adolescence, adulthood and later adulthood. So for example, if we think of the shingles vaccine, the flu vaccine, that's offered later on in our lives. Okay, we also have an immunisation programme for individuals who decide to travel to different countries where obviously there is higher risk of infection, and also for individuals from certain ethnicities. Okay. Now, unfortunately, obviously, if we decide to travel, then that cost would fall on our heads, being the individual who actually travels. And the NHS obviously only offers vaccinations to us for the diseases that would occur within the UK. Okay. It might be a good idea for you to understand certain immunisations and when they are offered, and also why they are offered to individuals. Okay. Okay, so I'm just going to skip a couple of pages here, just because of not having enough time to cover everything. Okay, so what we're going to look at now is mobile services. Okay, so again, some students might think of mobile services being something like offered through a mobile phone, through perhaps apps and things like that. Mobile services are something that perhaps can come to you in terms of your community. Okay, so if we consider breast screening, maybe some of you have seen large lorries or parked vehicles in supermarket car parks, and individuals then can present themselves in those mobile services to get screened for breast screening. Okay. Now, the reason that these services exist is to ensure that maybe individuals who struggle to attend their hospitals or areas where the screening is offered, it just is more accessible to them. Okay, and what we don't want to do is obviously not give every individual the opportunity to attend. Okay, so these mobile services then come to you to offer the extra support in getting screened. Okay. Now, obviously, the mobile screening service is offered to women over 50 years of age within Wales. And we also have counselling services. Okay, so again, perhaps we can get counsellors closer to us in the community rather than just be based in specialised areas where certain individuals would struggle to attend. We also have other services which are obviously not so much mobile based. However, there are services we need to be aware of, like holistic therapies, like acupuncture and massage. And the school nurse provides opportunities for us within school to have our hearing and vision screened. They obviously will immunise us within schools as well, provide advice and safeguard us, safeguard children. We have personal trainers who obviously will help with weight loss, improve fitness, maybe helping us with mobility when we're entering older age. And also then teachers will help us obviously promote a healthy lifestyle and encourage us with our diet, exercise, hydration, not smoking, vaping, relationships, friendships, etc. Okay. Now, the government also has initiatives. So these are not so much as guidelines, but initiatives in terms of priorities of the government, really. Now, the Flying Start programme is offered for families and children under 4 years of age. So the main purpose of Flying Start is to ensure that individuals can access part-time childcare. So obviously this not only benefits the child by being able to socialise and perhaps develop intellectually, but also helps families return to work at an earlier date. They also identify that maybe health visitors need to focus on the health of the children in certain areas, and especially in deprived areas. So this is something that we can enhance during this programme. Also, individuals as parents receiving help in terms of their parenting skills and allowing them to develop further skills to obviously raise their children in a safe environment. And also if we have problems with speech, language and communication. Okay, so this really is why Flying Start is available to us. And obviously individuals benefit hugely from the services offered with the Flying Start. The last one then is the active offer, which is more than just words. Now, this is an initiative from the Welsh Government to ensure that we have more individuals in the health and social care profession that can speak Welsh, just because the delivery of care services should be the same standard as English care services. So, i.e. Services should be allowed to be offered through the medium of Welsh, but obviously what needs to happen here is to recruit more Welsh language health and social care workers for this to allow individuals to get access to care through the medium of Welsh. Okay. Bit of services then is basically the community. So this is nothing to do with perhaps gaining a professional qualification in an area. This can be obviously just play groups by volunteers, really, by mums themselves who just think, right, they would be lovely for a play group to be established in this area, and they obviously can offer support for families, babies and children. Friends can be a massive help to us within the community in terms of having people to share experiences and get advice from. We can also have community centres offering us interaction in terms of activity, and there are faith groups as well. Okay, so I think what I was trying to show you here is that there are many areas of being able to intervene and prevent illnesses or individuals suffering perhaps with mental health problems. Some of these are very structured in terms of your immunisation programmes and your screening services, but also we can get a lot of informal support, which obviously is equally as advantageous to us as an individual if we are suffering with certain aspects of our life. Okay, please take a look now at the WJEC website, okay, to get that information that's been released for your examination, and that will allow you then to access the higher tariff topics that are likely to be asked in the summer. Okay, thanks very much for your listening tonight and your perhaps concentration skills. Good luck with your exam, and hopefully these sessions have been of benefit to you.